Thank you for your interest in state-based pediatric medical home resources. My name is Alex Kuznetsov, Program Manager for the National Center for Medical Home Implementation. I will provide you with an introduction to state-based resources available to advance the pediatric medical home, created by the National Center for Medical Home Implementation in collaboration with the National Academy for State Health Policy, also known as NASHP. Joining me on this recording is Barbara Worth, Project Director at NASHP. Barbara works closely with the National Center for Medical Home Implementation on the development of multiple state-based resources. So the National Center is a cooperative agreement between the American Academy of Pediatrics and the Maternal and Child Health Bureau in the Health Resources and Services Administration. NASHP is an independent academy of state health policymakers dedicated to helping states achieve excellence in health policy and practice. As a nonprofit and nonpartisan organization, NASHP provides a forum for work across a broad range of health policy topics within state government, including children's health and delivery system reform. After viewing this recording, you will be contacted with a request to complete a short evaluation survey. So the National Center for Medical Home Implementation collaborates with NASHP to create a variety of state-specific resources focused on advancing the pediatric medical home. These resources are unique in that they focus specifically on pediatrics. So to access these resources, you can begin by visiting the National Center for Medical Home Implementation website. The URL for this website is www.medicalhomeinfo.org. From the home page, you can access state-based resources by clicking on the National and State Initiatives tab in the global navigation located on the top right-hand side of the screen. So the National and State Initiatives landing page provides the visitor with a menu of options, including the following: all state initiatives, Medicaid and CHIP state profiles, and state pediatric Medicaid and CHIP medical home initiatives at a glance table. So the All State Initiatives section provides an overview of pediatric medical home activities in all 50 U.S. states and the District of Columbia. Visitors can select a state from the map or from the drop-down menu on the right-hand side of the screen. Each state page contains an announcement on new initiatives in the state, information on past and present pediatric medical home activities, partners, stakeholders, and contacts within the state that help to advance the pediatric medical home, and also data related to pediatric medical home in that state. The National Center for Medical Home Implementation collaborates with NASHP to systematically update these state pages. In particular, NASHP provides insights on any Medicaid and Children's Health Insurance Program, or CHIP, pediatric medical home programs included on the state pages. The state pages also include privately funded initiatives that advance the pediatric medical home in addition to Medicaid and CHIP information. Visitors have the opportunity to provide suggestions for including specific initiatives on each state page by completing the Contact Us form. So now I will turn it over to Barbara Worth from NASHP to provide some details about additional state-based resources focused on advancing the pediatric medical home. So Barbara, you can take it from here.
Thank you, Alex. The Medicaid and CHIP state profiles available through the National Center's website are also created in collaboration with NASHP. Specific state projects and initiatives that are proactively advancing the medical home model for their Medicaid and CHIP pediatric populations are briefly summarized within these state profiles. Examples of such programs include the Patient Care Networks of Alabama, the Glide Path Program of Connecticut, Iowa's Section 2703 Health Homes, and Vermont's Blueprint for Health program. Each state profile provides an overview of the program's components, the program's payment model, outcomes if available, links to more information, and fast facts about the state's Medicaid and CHIP beneficiaries. Each state profile is available for download in a PDF version. The States at a Glance table, available through the National Center's website, is also created in collaboration with NASHP. The table provides an overview of publicly funded pediatric medical home initiatives, such as those through Medicaid, CHIP, and the Maternal and Child Health Bureau. The table allows viewers to quickly identify which states have active Medicaid and CHIP payment for medical home programs, health home program state plan amendments with pediatric components, those states with state innovation model grants, and those states currently working on a systems integration grant from the Maternal and Child Health Bureau. The table specifically displays only those states with information that have pediatric components to each of the aforementioned public programs. The table is updated biannually in partnership with NASHB to ensure that all information is relevant and up to date. And now I'll turn it back to you, Alex, to provide some closing remarks.
Thank you, Barbara. And thank you for your interest in pediatric medical home state-based resources created by the National Center in partnership with NASHB. After viewing this recording, you will be contacted by the National Center for Medical Home Implementation with a link to a short evaluation survey. We encourage you to complete the short 3-question survey so that the National Center can continue to improve the quality of its resources in the future. Thank you very much for your time and consideration.